I'm Mary Claudette as Tolentino. I'm 43 years old, and I'm a licensed physician, and I'm currently working in the aesthetic industry for almost a year now.
Can you tell us about what alopecia is?
Alopecia is a medical term for hair loss. No, it refers to a condition in which hair falls out of the scalp and other parts of the body due to various causes. So usually hindi naman siya limited dun sa isang cause lang like hereditary, no. So many causes talaga siya. Pwedeng hormonal, pwede siya genetics, which is yun nga, yung sobrang ano ngayon, no. So more on genetics talaga siya. And then yun yung androgenetic pattern hair loss kung tawagin natin. So maraming kinds ng alopecia, pero it's a medical term for hair loss. And then usually yung severity and yung treatment usually depend siya. So you need to know kung ano yung underlying cause para maging proper yung treatment mo for alopecia.
Can you tell us naman po yung importance po of knowing whether or not meron po kayong severe hair loss or alopecia?
Yeah, it is important na not all hair loss are the same. So, we need to know yung degree ng hair shedding sa bawat patients, no? But, pag persistent na siya and then excessive yung hair loss, then it may indicate an underlying medical condition. So, you have to determine talaga kung ilan yung degree ng shedding niya. So, para maging okay din yung treatment mo. And then, once ma-identify mo yung cause, no? So, basically, ma-receive mo yung appropriate treatment for the patient and also increase mo yung likelihood for the for preventing the permanent hair loss.
One participant described alopecia as simply balding, while hair loss happens for random reasons po. Is this an accurate way to differentiate the two?
No, that is usually a misconception. No? Hair loss is a broad term that refers to the excessive shedding. So, yung alopecia is, on the other hand, is a medical diagnosis. Hair loss does not happen randomly. So, there should be an identifiable cause talaga.
Could you help us explain the relationship po between normal hair shedding, hair loss po, and alopecia?
Okay. First, yung normal hair shedding, usually, part of the normal hair growth cycle, no? We usually lose 50 to 100 hairs each day. So, yun yung normal natin, no? Pero usually, pag meron tayong hair shedding, nare-replace siya. Yung hair loss naman is that when the shedding becomes excessive, more than 100 hairs, no? When yung hair fails to replace the lost hair. So, yun yung hair loss. Yung alopecia is a hair loss, is one of the signs and symptoms ng alopecia. No, pero yung alopecia itself, meron siyang underlying disorder causing that hair loss.
How would you explain the difference po between a medical condition like alopecia and the normal hair shedding that people experience every day?
Normal hair shedding is temporary and it happens every day naman. It's part of the normal hair regrowth natin, no? And people continue to grow their hairs, and so overall hair densities remain stable. However, with alopecia naman, no, there is an imbalance between the hair shedding and dun sa pag-grow ulit ng hair niya. And then unlike normal hair shedding, alopecia often requires medical intervention na.
If you could correct one misconception that many working Filipinas have about hair loss and alopecia, what would it be po?
Yung hair loss is just a cosmetic issue or it's part of an aging process. However, persistent hair loss can be an early sign of an early medical condition. So that's why we encourage like Filipinas to if they have hair loss, no, if they have abnormal hair shedding, magpakonsulta na sila kagad.
So Doc, can you explain to us po what dermoscope is?
Okay, dermoscope is a certain machine that we use or what we also call trichoscope. No, it's usually for the hair para makita mo yung how healthy your scalp is, para ma-explain din dun sa patient kung paano yung magiging treatment din. No? Kasi minsan kapag nakita mo sa dermoscope, no, minsan parang brown na sa scalp, wala ka nang makikita parang pwedeng tubuan ng hair. Doon magbabase din kasi yung treatment namin.